Hi, I'm Snehal. I'm a PhD scholar graduating from the University of Queensland and collaborating with the Royal Children's Hospital. My research is mainly focusing on how kids with cystic fibrosis acquire an infection with a bug called Pseudomonas. Cystic fibrosis is a genetic condition where almost 1 in 2,500 live births in Australia or in Caucasian population are affected with cystic fibrosis. Patients with cystic fibrosis quite often get an infection, respiratory infection with a bug called Pseudomonas. Pseudomonas is a bug that is very commonly found in our environment. It's found in everyone's houses usually. It would be present in my house and your house too. But not all of us get infected with it because our immunity is quite high. But patients with cystic fibrosis have very low immunity, and because of that, even such a simple bug can cause serious infections. The reason I'm researching into this particular bug is because it starts as an acute infection, but then eventually develops into a chronic infection, which means you can't even get rid of it even with strong antibiotics. And it is one of the major causes leading to early death in patients with cystic fibrosis. Not all strains of Pseudomonas can cause infection as well. There are only particular strains that cause serious infections in patients with cystic fibrosis. So the aim of this study was to actually see if that particular strain of Pseudomonas is present in the houses of the patients. So far we've studied 40 homes of patients, and we found that in a few homes there are strains of Pseudomonas actually present. So this research will aid in finding better ways of protecting patients with cystic fibrosis from infections with these particular bugs, hopefully. We will then ultimately be able to prevent them from getting the infection that early in life, and thus hopefully extend their life expectancy in general. Funding for cystic fibrosis is really important because general public out there are quite frequently aware of cancer, diabetes, but very few people are actually aware of the seriousness of the condition of cystic fibrosis. That, like, cystic fibrosis actually causes a very serious health issue in kids and in adults. And the lifespan of patients with cystic fibrosis is around mid to late 40s at the moment, which has considerably increased in the last few years because of the research that we're doing.